you see that?
Back it up a bit. Back it up some more. No, I can't see it.
Okay. Anyway, it's 95 with a pulse of 128. My pulse is high because I'm winded. Phil just worked on my... Sorry. Phil just worked on my left chest. Hi, sorry that was an awkward beginning to a video. This is Dr. Missy, and I'm trying to give you a special video today, kind of an advanced class on the right lung, just the right lung. I was diagnosed with a pneumonia on the right lung on day 21. Today's day 23, I think. Anyway, he just cleared my left lung, but listen. So, my right lung is filled up again. We did this about 10 o'clock this morning. It's now 4 in the afternoon our time. So in about 6 hours, it reaccumulated. And I could tell out there I was starting to cough more and couldn't take as big of a inspire, like inhale. And I was noticing right over here on my right upper rib cage on the right side that I'm getting a sharp pain there, like when I'd gone in and got diagnosed with the right pneumonia. So it's bugging me right now, so we're gonna go do this. Phil's gonna work on the front to show you how to do the front, okay, including up the sternum. The right side from the armpit, you know, your ribs that go all the way up here, you know. So anyway, he's gonna work it from the armpit all the way down to my lower rib cage. And then from up here, which is the apex of the rib, or the apical part, the really top part, and all the way down the right side to my right lower rib cage. In between, when I cough, he might drum a little softer or give me a chance to catch my breath to get the sputum out, to get the phlegm out. But I'm going to be trying to do the proper breathing, which is out and in through a pursed lip. And I'll try to get 5 of those clear before I do something new, especially once I do the postural drainage. He's going to leave so I can do that postural drainage. So this might be kind of a long video, but I consider it an advanced how to get the right lung fully drained technique, especially if you got pneumonia over there and you don't want that to get bad because pneumonia is already bad. I am also on an antibiotic. I just finished my Z-Pack yesterday, and I just finished my hydroquinone, whatever. I can't say that word. I don't know why. Chloroquine. Hydrochloroquine. Thank you, Phil. I just have a mental block on that word. Mentally, I'm not functioning at my top, so take all these videos with a grain of salt, apparently. I am still on Augmentin for 5 days, and that's probably, according to a friend of mine, and I know this too, Augmentin can really wreck with your stomach, so maybe that's why my diarrhea got worse. I'm doing fine today, but the day I'd gone into the hospital, it was really bad. Anyway, here we go. We're going to work on the right lung because I have right lung pneumonia. Apparently my right lung pneumonia is right here in the middle, but he's going to work all of it. So here we go. having a hard time coughing it out, I just keep coughing out and coughing out and coughing out and coughing out as I exhale into my last little breath, okay? And then I take a deep breath in, and that somehow gets it loose enough to be able to cough something out. I don't always do that, but if it's getting stuck in there, you'll see me breathe that way on exhale. I just go cough, 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 cough. Oh gosh. See, Phil can tell you what he's doing here based on my coughing.
So if she's got dramatic coughing, I'll usually slow down a bit just to give her a break. And I'll keep working one area until she no longer coughs when I'm working that area. And then I'll slowly move on to another area and come back a little bit later and hit that same area again. For those of you who don't recognize it, I am tapping to the beat of Donna Summer's I Will Survive.
He's hilarious. Are you talking about you or me? Both of us? Ugh. Do you want me to roll back some?
All right,
Or stay there?
stay there.
See, he's watching my breathing, and if I get through a few cycles, he knows he can move somewhere else. Oh, gosh. I'm really sweating bad again, and of course I'm winded. It's not terrible, and if I have to take a break, I just do like this, and he'll stop for a while. He doesn't want to hurt me. The thumper is your helper. Communicate with him, and he'll communicate with you too. Okay, I got it up. Part of the problem is I can't really expand my ribs quite as well. When you there's little muscles in between each of these ribs, so your ribs actually move, and when you breathe in, the ribs spread out and your chest gets bigger, and when you breathe out, your ribs contract and get tighter together. It's really very cool. There's actually, they're called intercostal muscles, so they're right in between the ribs, and that's exactly what they do. The rib cage doesn't just sit there. It actually breathes out and in just like your lungs do. So anyway, my muscles are getting tired. So sometimes I have to cough a few times to get stuff up from deep, where maybe a week ago I wasn't quite so tired. Bat virus. Really? It's ridiculous. It's okay to get angry at the bat virus. Don't get angry at your helper. You need your helper. What are you doing?
Cupping and
But you're going faster,
pounding.
you're going harder.
I'm going faster and harder, and it depends on
He's doing advanced pulmonary
How much?
lung drumming.
expirations he's doing. The other thing is I'll alternate from more wrist wrist action, which works your forearms, and when your forearms get tired, then you can use your triceps and use your forearms more without flicking your wrist so much, or a combination of both of them.
How are you standing there so your back's okay?
I got my feet under the bed, with my knees up against the mattress, and so right now I can stand up straight, but when she leans over later, I'm able to put pressure on my knees and just keep my back straight. So if I have to reach over once I start on her back or her chest, I'll be doing that. But you want to try to keep your back straight, otherwise your lower back will start giving you a hard time in talking to you.
All right, so that's good. So did we do this yet?
Yep.
We didn't, did we?
Come over this way a bit.
Oh.
Okay. So right here I'll lean forward, but rather than bending down, I'll keep my back straight.
I'm always trying to cough away from him. If you have the virus, you wear a mask. If your person doesn't have the virus, they should wear a mask. I mean, you both should wear a mask, but we both have it, and we're just like, ugh. So I try not to cough on it because I don't want him to get more virus. Although our apartment's probably a fishbowl. See, the lung comes all the way up here. He's coming way up there by my neck. ribs, the lower lung lobes seem to collect it more, like where he is now. The fluid.
Which makes sense since you're sitting up, it would be draining down.
So I think that's pretty good. Oh. So now we'll do the front. And we're doing kind of more than usual here. We're not just staying down here. First few days we did, but then we're doing more. You want to cover your skin up, otherwise, even with cupped hands, it'll feel like he's slapping you and it'll hurt. And again, I'm pointing away. I'm trying to do the breathing exercises while he's trying to get, and he'll even get above my rib cage or my collarbone there. Just doing the right lung. Everything we're doing now is right lung because I got the pneumonia on that side and I wanted this to be a video about right lung pneumonia, how to make it at least as good as you can make it around your pneumonia.
And we did our left side before the video started.
Yeah. So he's running down the sternum, that hard plate on the front. You know, your ribs connect to the front by this sternum. Gross. Gibson, hey! Gibson! Sorry, everybody.
We're just about through.
Did you do down here?
Yeah, I did.
Okay. So yeah, we're all done. Now I'm gonna show you. Phil's gonna leave.
See you guys.
Thank you, honey. Okay, so you saw that he did the front of the lungs and the back, and to drain the back, I've been seeing a lot of the ICU patients that they show on TV. They're actually face down, being ventilated face down, so they're obviously trying to drain the back of their lungs. This is how you can drain the back of your lungs. You want your thigh straight up and down, so your hip is as high as you can make it. See here, my hip is lower. So my hip is as high as I can make it. I got a little pillow here, it's not really doing much. And then my shoulders are gonna be really far down. Try to get my head out of the way. So my hips, wait, I think I moved my thighs, didn't I? Anyway, you have to give it a few minutes. Nothing really happens, and then all of a sudden you start gurgling, and then you start choking, and then takes a little while for gravity to work. But this is draining the back of my lungs up and out. Same breathing exercises. You'll start to feel a tickle. See, it seemed like it was going to be fine, and here it comes. I feel that pain right there on that right side, which is that pneumonia, but I'm just going to keep pushing through it. I'm sweating a lot. So the postural drainage is gonna, I coughed up a lot when Phil was doing his thing, but more stuff is gonna come draining. That's why it's called drainage, postural drainage. I'm in a certain posture and it's gonna drain. And I'm doing this to get the last little bit out that I couldn't cough out. That was something that came up. I had to clear my throat there. We keep doing this, 5 minutes. It may not take that long, but I need to give it a little time. You want to be well hydrated when you do this, so your mucus along your bronchioles, main bronchus, trachea, all that, you want it to be mucus rich. I drank a big glass of water, the 16 ounces before this session. You could also get in a hot steam room, like your shower. Just turn the shower on really hot. Get the kids out of there unless you're doing a treatment for a child so they don't get burned on it. You're not going to get in the shower. I mean, you could, but you don't need to take a shower every time you do this. But you could. So I just put the toilet lid down, the seat lid down, and I sit there and wait for the bathroom to billow up with that hot, steamy, moist air. And I do these same breathing exercises. I never change them. If I feel like I can't cough things up, the only thing I might change, instead of just breathing in real deep through an open mouth, breathing out fully with an open mouth and in deep with a pursed small opening in my mouth. The only thing I would change, if I start to cough and I don't feel like I can bring it up, I just do that. Remember we had that breathing exercise? I just cough, 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 cough. Like I might cough 20 times in that one time that I'm exhaling. And then when I breathe in, it just seems to have loosened it up and I can really pop it out. So you might see me do that. It will tickle, like irritated tickle, either kind of down in your lung area or up in your throat area when you're just about to gag or cough on it. We're at the phlegm gym. Missy's sweating and she's winded. Phil's triceps are tired. Try to get a little lower with my shoulders and a little higher with my hips. I think that's straight up now. You want to clean out every nook and cranny. So every little spot that's in the back of my lungs, I want it out now. It's like spilling a whole can of Coke in your kitchen. You're not just going to clean the little blob in the middle, you're going to go out to the corners. Otherwise it's going to be sticky and it's going to attract more debris. So clean the whole kitchen floor, please. Thank you. I'm in a better mood today, so my analogies are probably going to be bizarre, but understandable. So let's just say I got Coke stuck in the corner of my kitchen, and I think I still got a cough or two left in me. So I'm going to do my breathing, because you can tell when I'm not breathing and I'm talking, I don't cough much, but watch when I breathe. Oh, gosh. Oh. See? The breathing really works. So don't be talking to the thumper. Don't be talking to a friend while you're doing this. You actually want to practice on your breathing, okay? Please. had some in the back of my lungs, didn't I? Gross. I'd rather spit it out, but it's so sticky and it's so in the back of my throat I'm having to swallow it. Trust me, I'd rather spit it out. It makes me very nauseated, but I'll take it to have good lungs and not get on a ventilator, not die, survive this without any lung scarring. I want to have normal lungs after all this. You should too. I know you want that. For your children, for your grandma. You know, if you let people like grandmas, if you let them get so much junk in there and they never quite get it out, number one, they could die. But if they don't die, they could get such scarring that suddenly they've gone from this vibrant woman who played with the grandkids and all that to somebody who's in a wheelchair. I mean, if you don't have good lung capacity, it can change your life or kill you. I'm trying to take a really deep breath in. I still feel that pain back there, but I don't think that's going to go away because I have a little bit of a pneumonia that my Augmentin is working on. But I'm gonna breathe in until I feel it. Oh. As an orthopedic surgeon, there were times early in the recovery where we said, if it hurts, don't do it. You're going to break the metal hardware, the pins and screws and plates and screws and whatever I put in. You're going to rip out your graft, etc. Don't do it if it hurts. But later on, you know, when it was 4 months out and we're like, hey, don't you want to ski in a couple of months? We'd really get after you and say no pain, no gain. Well, to me, this one, on the deep inspiration, it is not time to wimp out. I don't care if it hurts. Do it. Okay? I'm not going to be responsible for any of you. You know, come on. I'm sorry. I'm feeling feisty because of this damn bat virus. I'm not mad at you. I'm just mad. 23 days of my life? Are you kidding me? I mean, I am grateful too. And Phil, he saved my life. Okay, so I think you get the idea on the back is pretty well done. So now, remember, the left bronchus is fairly horizontal. I mean, it's got a little bit of an angle, but it's fairly horizontal. This one's fairly vertical. So we really want to get our left and right hip up so that our left and right shoulder are down, so that our postural drainage is actually working more in line with gravity. Because see, gravity only works like down. And I'm going to show you another technique off the end of the bed. Man, I'm sweating. It's good if you break a sweat. It's not because I think it's because you released all that stuff and your body kind of has that kind of response. So here we go. So my hip is above. I can see that my shoulders are down. Same thing. When I first get in this position, nothing may happen, especially if I'm talking, but watch what happens when I start to do the proper breathing. one. You know, if you've had 3 or 4 good deep breaths and you're not coughing up anymore, take even deeper breaths. You want to really expand. Remember these ribs, they do actually move. That rib, there's little muscles there, and they're going to kind of spread out, and then they're going to come down. So when I inspire, when I breathe in, I want it to go as much as I can do. And I can tell I'm not doing as much as I did before I got sick, so I'm trying so hard to get my full lung capacity back again. I don't want to have crappy lungs because some stupid bat virus. Are you kidding me? That is not happening. I try to stay in this dependent position, but if I get a little winded or choked up, sometimes you'll see me raise up to cough because I've gotten so weak. I mean, my muscles right here, my rectus abdominis muscles, where they attach to the ribs, every time I cough, I get a sharp pain there. I've probably coughed 100,000 times. I don't even know. It'd be interesting to do the math on that. I might geek out and do the math on that for you someday, but it would be a guesstimate. Might be cool to do, though. We'll see. If I'm up in the middle of the night, I'll do the math on it. Okay. Again, when I talk, I'm not going to cough a bunch of phlegm up. It's interesting, isn't it? But watch when I breathe. Trying to get on this pillow better. I hear wheezing. Wheezing means the pipe isn't wide open. It's kind of got some crap in there, so it's like a whistle, you know, and it starts to whistle. That was a really good deep breath. No tickle. I still hear a wheeze, though. Oh, that was a good one. So that's going to drain my right side. And I showed you how to drain the back. To drain the front, I mean, you would kind of do the same thing in this position, right? So anything that, you know, the main bronchus is kind of in the center of your lungs, I think. I'd have to look at the anatomy, but let's assume the main bronchus is here. And you got lung behind it and lung in front of it. Okay? So let's say there's some lung in front of my bronchus. So that front, now that gravity is working, the front where Phil did this and this, that front should be draining now. So watch, here we go with the breathing. It's going to kick it up again. Hope you're getting some out of this. I feel kind of dumb doing a long video, but I don't know. I just didn't see anything like this on the internet, and my mom was laughing at me this morning. I used to always play school before I was able to go to school. You know, my brother was 3 years older, so my brother would go to school, and then I'd come home. We'd drive him to school or whatever, maybe. And then I would invite my little friends over who didn't go to school yet when we'd play school. And guess who was always the teacher? And if I wasn't, I didn't play. That's so funny. So look at me. Oh, life's a big circle, isn't it? All right, here we go on the breathing. So that didn't drain so much. I mean, I do feel some stuff going in, but not much. So I'm gonna put something behind me to kind of elevate. So I'm back, but this is sort of like this now, okay? I think it'll get these better. Okay. Come on, sweetie. It's okay. Come on. Yeah, come on. You're a good puppy. I know. It's been a long time. It's okay. Ugh. So there's some in there, but I think my friend is pretty well cleared. My sides seem pretty well cleared. My back seemed pretty well cleared. So the last thing, I had a friend. Did you come see me? Did you come see me? You're a good puppy, aren't you? Yeah, you're a good puppy. It's okay. You stay right there, sweetie. Yeah, you're a good boy. Lay down. Stay right there. That's a good boy. So my friend is an asthmatic, adult asthmatic, and when she was a kid, the doctor would make her, your belly's off, your chest is off, your hips and thighs and legs are on the side of the bed. I'm kind of resting here. I'm already feeling it building up in my throat. Okay, here we go. Breathing exercises. This is the last little bit. Now this is very vertical on that bronchus, isn't it? On that right main bronchus. So this ought to get up a few more. Again, we're trying to clear out the corners of the kitchen where the Coke got in the corner of the crack. We don't want no sticky stuff down in there because it'll develop a pneumonia, right? You leave stuff behind, it becomes the perfect little environment for a pneumonia to set up. Clear lungs don't get pneumonias. Okay, breathing exercise. Sometimes fart, sorry, it's kind of hard in this position not to. I'm sharing so many bodily functions with you guys. I'm sweating, I'm crying, I'm hacking loogies, I'm farting. Good Lord. The Lord is good. He's made me be able to do that for you. Trying to really get those lungs big. Well, hi, Nika. What are you doing under the bed? Are you hiding? Come here. Come This may not be a position for Grandma or a sick patient, but and I got a back problem, so I got to be really careful getting off of here. Won't make it look too graceful, I'm sure, but I got it. I've had some dizziness, so I do need to be careful when my head is really down, that I come up slowly, like I wouldn't just go from there and stand up. It might make me faint. But I did want to get over here and show you that I'm just real sweaty, and you will be too. It's just when you cough up all that phlegm, that's the body's reaction to all this. Anyways, Dr. Missy Medical School, advanced right lung, chest percussions, and pulmonary drainage for pneumonia. And I'm showing anterior percussive techniques, lateral percussive techniques, and posterior. I also showed you a bunch of postural drainage techniques, so that's about as much as I think I can tell you about the right lung. And you do the same stuff for the left lung, okay? Anyway, I love you guys. Happy Easter. It's a great day.